How is hypertensive encephalopathy treated? If you are curious about how hypertensive encephalopathy is treated, you are in the right place. This condition arises when there is a sudden and severe increase in blood pressure that affects brain function. The treatment is critical and focuses on carefully lowering blood pressure to prevent further brain injury and complications. Initially, treatment occurs in an intensive care unit where healthcare providers can closely monitor the patient. The first step is to reduce the systolic blood pressure by no more than 25% within the first hour. After that, the goal is to gradually bring it down to around 160/100 millimeters of mercury over the next 2 to 6 hours if the patient remains stable. It is essential to avoid dropping blood pressure too quickly, as this can lead to reduced blood flow to the brain and potentially cause ischemic strokes or damage to other organs. To achieve this, parenteral or intravenous antihypertensive medications are preferred. These medications act quickly and can be adjusted precisely. Common options include nicardipine, labetalol, esmolol, phenaldopam, sodium nitroprusside, and clevidipine. Phenaldopam is particularly beneficial for patients with kidney issues due to its protective effects on the kidneys. Initially, oral antihypertensive medications are avoided because they work slower and cannot be easily adjusted. In some cases, seizures may occur as a complication of hypertensive encephalopathy. If this happens, short-term treatment with anti-seizure medications may be necessary to manage them effectively. Once the patient stabilizes, they typically transition to long-term oral antihypertensive therapy to maintain blood pressure control and prevent future episodes. This may include medications such as angiotensin receptor blockers, calcium channel blockers, and diuretics. Beta blockers can also be used but are usually introduced after other medications, especially in specific conditions like pheochromocytoma. Lifestyle changes play a vital role in ongoing management. Patients are encouraged to reduce sodium intake, exercise regularly, and stick to their prescribed medications. These steps help control hypertension and lower the risk of future hypertensive emergencies, as well as related heart or kidney disease. In summary, treating hypertensive encephalopathy involves carefully lowering blood pressure with intravenous medications, avoiding rapid drops, managing any seizures, transitioning to long-term medications, and making lifestyle changes. This approach aims to stabilize brain function and prevent complications while reducing the risk of further hypertensive crises and cardiovascular damage.